The TB Journey Determinants Map for Northern First Nations communities is an educational resource for service providers to TB-affected First Nations communities. The map visually depicts key stages in a typical TB patient's journey, moving from exposure to treatment completion, and the different healthcare-related, social, and First Nations determinants of health. Addressing tuberculosis in First Nations communities requires more than just a focus on improved diagnosis and treatment. Rather, upstream approaches should be used to reform the fundamental social, political, and economic systems that First Nations populations interact with daily. An upstream approach to tuberculosis will effectively address the social and structural determinants at their roots, and will also generate health benefits well beyond eliminating tuberculosis. Upstream approaches focus on the societal conditions that keep people healthy. Factors like adequate income, meaningful work, education, community connection, decent housing, and healthy food. First Nations-led solutions and community involvement in major decision-making processes create better understanding of the unique First Nations experiences and fosters trust between healthcare providers and communities. Developing spaces where First Nations identity and languages are recognized and respected will allow for more culturally competent and safer care. And if they are accompanied by meaningful changes in external systems, will increase the likelihood that community members will receive appropriate care to treat any infections. The intergenerational trauma resulting from colonialism is complex. It is perpetuated by Western ideologies and approaches that continue in today's current systems. Decolonization is a difficult task that involves deconstructing colonial systems that continue to marginalize First Nations and other Indigenous populations and sustain power disparities. Decolonization revitalizes First Nations knowledge and approaches to health, healthcare, and quality of life for all Indigenous populations in Canada. Using the TB Journey Determinants Map for Northern communities helps to center First Nations TB patients and see the influences of broad determinants that shape the journey towards health.